guys, welcome to my YouTube channel. Today I want to talk about vericose veins. Vericose veins are like a swollen vein appear just under the skin in your leg, feet or ankle. When your vein become weak and your valves are not working well, so the valves are not working, so they don't pump blood to the heart, so the blood flow back to your vein. That's when vericose veins happen. This cause like blue or purple bulge, so you can treat vericose veins. What are the vericose veins? We say that it's swollen, engorged blood vessel that bulge in outside under your skin surface. It can be under your feet, your ankle, or your legs. They can be painful or itchy. Also, there is a spider vein which may surround vericose vein. A smaller, also red or purple line that appear close to your skin surface. So if you see a spider vein that is vericose vein. You may not like killing, or you may not like the way it looks because of that bulging of your vein and how it feels, but they are not that dangerous. So severe vericose veins can lead to some serious health problem like blood clot, but most of vericose veins, the system can be treated even at home. If you have more serious, you can get treatment. And also vericose veins are common, especially when you are someone who stand for long, sitting, pregnancy, aging, all that. So what are the symptoms of vericose veins? One is bulging vein. Twisted, swollen, rope-like vein are often blue or purple. They appear just below the surface of the skin on your legs, ankle, or the feet, mostly on your calf also. They can develop a cluster. The red-blue line, spider vein, may appear nearby. Heavy legs. Another one side is bulgy vein. Second is heavy legs. Muscle in your leg may feel tired, heavy, or sluggish, especially after physical activity. So that's another sign. Itching. The area around the vericose vein may itch. Pain. Leg may be painful, itchy also, especially behind the knee. It's where very painful. Pain or muscle cramps. Another thing is swelling. Your leg, anklet, and feet can swell and drop. Skin discoloration and ulcer. If you didn't treat or without treatment, vericose vein can cause discoloration on your skin. Severe vericose vein can cause venous ulcers on your skin. Where do vericose vein usually appear? Why? Where does it appear? That's what I mean. Most often, vericose vein develop on your lower calf, half of your body, lower. Usually on your calf, anklet, and feet. They can also develop your pelvic area, pelvic congestion syndrome, especially in people who had children. Hemorrhoid which form in your rectum are also vericose veins. So hemorrhoid are also vericose veins. So what causes vericose vein? Vericose vein occurs when the wall of your vein weakens. A blood pressure on your vein increases. It weakens the wall of your vein. When it gets bigger as your vein stretch, the valve that keep blood moving in one direction in your vein can't work. So the sluggish blood back to the pool in your vein, causing your vein to swell. That's it. That's what cause. So each pool in your vein, causing your vein to swell, bulge, and twist. Vein wall and valve can become weak for several reasons, including normal aging, standing for a prolonged period of time, hormones, excessive weight. If you become fat and you were slim before, you can have vericose veins. Those are some reasons. Let's talk about what are the risk factors of this vericose vein. Anyone can develop vericose vein. Certain factors increase your chance of developing, including age. Because of aging process, vein wall or valve don't work as well as once. Vein loss elasticity and stiffen. Hormones. Female hormones can allow the wall of vein to stretch. Women who are pregnant or taking birth control or going through menopause have higher risk of varicose vein because of change in hormone. Family history. You can inherit this condition. Also, lifestyle is another cause. Standing or sitting for long period decrease circulation. Overall health. Certain health condition can increase pressure in your vein. Tobacco use. People who use tobacco products are more likely to develop varicose vein. Weight gain put pressure on your valve. So those are the risk factors. Also, what are the serious complications of varicose veins? Because varicose vein, severe varicose may cause a chronic venous insufficiency, a condition that affects your vein ability to pump blood to your heart. So one of the complications is superficial thermophlebitis. Blood clot can form inside varicose vein, causing superficial venous thrombosis or superficial thrombophlebitis. Very painful. Or superficial thrombophlebitis is painful but isn't that dangerous. It's not like DVT. Another complication is deep venous thrombosis. If you have varicose vein, you have a high risk of deep venous thrombosis, a blood clot in vein deep inside your body. Another one is pulmonary embolism. A blood clot in your body, usually from DVT, can get in your lungs and cause pulmonary embolism. It's a life-threatening condition that requires immediate treatment. So those are three: deep venous thrombosis, pulmonary embolism, and superficial thrombolysis. So how will you diagnose or test? How will you know? How will someone know? Varicose veins are close to the surface of your skin, easily, even you can see it. Healthcare provided by physical examination. You feel your vein and examine while you are sitting and standing. They may also ask you question. What test will you do to know varicose vein? Sometimes there's additional diagnosis beside physical examination to prevent the complication. So you can do ultrasound. This is safe, painless test. Use sound wave to see. So let's talk about management and treatment. Although it seems that there's no really cure of venous varicose veins, treatment can be look and feel better. Elevation of your leg to increase blood flow and decrease pressure in your vein. You should elevate your leg above your waist several times throughout the day. Elastic stocking, supportive stocking, or compress your vein and reduce discomfort. Also, there is injection therapy, sclerotherapy. During sclerotherapy, a healthcare provider injects solution in your vein. That's another one. Laser therapy is minimum invasive protocol. Endovenous thermal ablation. Also, that one can be done to help. Also, there is ambulatory phlebotomy. Make multiple cuts or puncture in the skin next to varicose vein and tie off or remove a section of it. Also, there is a vein surgery. During this procedure, also called liquidation or stripping, the surgeon tie off affected vein to stop blood from pooling. So those are the things. So complication or side effect of the treatment. Those treatment we have talked about. What are the complications? Pain, bleeding, scarring, skin burning, numbness, infection, injury to the nerve, deep vein thrombosis, redness, bruise, all that. Rarely a stroke. So those are the management. So management and treatment also you can need your skin change in color if you see lump, handness, or if you or stroke. Those are also signs. Those are complication or side effect. Stroke, we say stroke is rarely. Can varicose vein return after treatment? Although treatment are effective, varicose vein can return. They more likely come back people who become pregnant after treatment, or if you stand for long. So what to avoid? Prevention of varicose vein. Avoid long period of standing. To encourage blood flow, take regular breaks to stretch and walk around, especially if you have a job that requires you to be in your feet. Elevate your legs. Raise your feet above your waist. Help blood flow to your heart. Maintain a healthy weight. Get rid of excessive pound. Reduce pressure inside your blood vessel. Quit tobacco. Use smoking. Stop smoking because smoking will damage your vessel, decrease blood flow, and cause wide range of health problems. Stay active. To improve circulation, move frequently. Do not stay in one place. So stay active. Try compressive stock. Wear clothes that fit you well. That's that. How will I take when you are living with varicose veins? How do I take care of myself? That's the question people ask. A very long period of sitting or standing, get a regular physical activity, put your feet up, standing at or staying at a way that's healthy for you, avoiding tobacco. That's what we talk about it. When will you? Because some people say with spider or those varicose vein. Why should I see? When will you see you are healthy? Why will you see? When you have bleeding, scar, painful, red worm, or touch swollen. This can be a complication. Guys, ask any question about varicose vein because it's common. You have spider, varicose vein, painful anklet mostly, and examine your legs always. Thank you for watching. See you soon.